Thank you. As a team, we are unbeatable. Complication, you know, and we should avoid it because sometimes the lymph blows up like this. They have to go even to the hospital to be infiltrated with antibiotics and yeah. So nerve lesion, of course, pain. Nerve lesion is pain. And diabetes, you know, with diabetes, we do not know how their vessels are, and you better be careful. And therefore, this is, for instance, one case when you know how to bandage, we use long stretch, a light bandage. Not that light that it falls down, but just. And then, of course, when you have a peripheral occlusive disease, an arterial one, when the arterial circulation doesn't work properly. Smokers have it a lot, so they have these completely pale legs sometimes, and open wounds, I said it already. Flat knit material, they are like, you see, and so I go back and back here. Once more back here with the seam here, and I will come a little bit later to it why this is so important that you have a flat knit material. As it says here, it guarantees individual fit. I will explain to you as well. And there are many compression classes possible, much more than with a round knit. But the round knit, they come in many colors. And if you want to be a nice girl, so you use different colors, and that the flat knit material doesn't have so much. And the number of stitches can be varied, and also I will explain to you why this is so important. And also the material is thick. Stretch it a little bit and look it to the sun, you see they are very permeable to air, much, much more than the round knitted. And many extras possible you do not have with the round knit. Disadvantage, yes, they have a seam. Okay, earlier we had stockings with seam and this was modern. Now it's not modern any longer. And of course the material is much thicker and more expensive. Yeah. The circular knit, it's seamless, it's a thinner material you can put on easier, it's cheaper and fashionable. In all colors you might have it. Disadvantage, there are less classes, compression classes. And you cannot have any extras in there. And I will mention some extras a little later. And you have always the same number of stitches. With the other one, you can add stitches. And it's more problem, and that's our problem, that it rolls up and cut in. And when you have an arm, and it comes down a little bit, where does it roll to? To creases. And then sometimes you see patients with deep creases there, or when it is a leg in the hollow of the knee. And this is awful. It stops. Here we have lymph nodes. In the creases, in the hollow of the knees we have lymph nodes, and then they interrupt the lymph flow. Yeah. Our patients have only flat knit, and this is a recommendation we give to everybody. So flat knit we use with all lymphedemas and lip edemas as well, and mixed edema, lymphedema. It's a mixture between lip edema and lymphedema. And I tell you, they like it. Lip edemas is something different, but then even if they have to wear pantyhoses, they feel so relaxed once they are a little bit used to it. And they could not live any longer. The other day I was with one of our therapists. She accompanied me, and when we arrived and started Monday morning with the class, she said, "Oh, for heaven's sake, I forgot my pantyhose." I said, "Is that bad?" She said, "Of course. I get so tired in the evening. My legs are, they give pain. They are painful, and I feel like halfway naked, you know, without these things." Okay. So the circular for flap edemas, these are venous edemas. That's okay. And light lip edemas to please the patient a little bit. And sometimes you have to do compromises. That's it, you know. No whip, Renee. The garment should be put on each morning before they run around, and then put it on as early as possible. Worn all day, and please do not go to bed with your garment and put it off. Shower at night, and then you can leave the bandaging you can leave on, but not the garment. So there are some important notes, and we have to explain this to the patient. And of course we have to take into consideration the age of the patient, the readiness, whether they have help. It's the readiness and the ability. And then always we have to find out there are different classes when we take the flat knit, and whether they can put it on. When I have a 80 years old lady, how could she put on compression class 3? It's impossible. She needs help. The husband is older, or she has no help any longer, and the kids are not living there. So it's really, so sometimes then it is better to put one layer of garment on the other, but then the insurance companies don't pay. So this is sometimes really difficult to help our patients. And then we have to consider the profession. So double garment is recommendable, and yeah, additional diabetes or these things have to be considered. And this is instruction for taking care, so daily wash should be, therefore when they leave our house they have one garment, and when this fits we order immediately the next one, and the insurance company pays 2 garments, and so they can wash every day and dry it. And hand washer machine on the chandelier, and mild detergent drying, no dryer of course. And the best thing to roll it up in a towel and then hang it on and let it dry. No sun, no heating here. Correct putting on and taking off. You cannot put it on and then pull like this. Use gloves. They have these dots, and you can really push it into the right position, this garment. At home they are shown how they have to put this on and how they get the right size on the lower leg and the right size on the thigh. And then skincare, of course. These are helps. This one here is for arms, and this is for legs. So they can, this is helpful sometimes. And here you see how they step in. This is for the arms. And these are helps for taking it off. Because the most difficult part is, of course, the heel. There, you don't get it over that. It's really difficult. And there it helps, and you take it out or off as well. Now you can have different garments for arms. And you see here, this lady has not closed fingers, but she has long fingers up to the bed of the nails, and she has only the knuckles in. The thumb is always in. And here you see it again now. Jobst has this seamless, where is she? The seamless handkerchief. That's you. Yeah, wonderful. Jobst has a handkerchief, no seams any longer. great. And you know,